Okay, youth vaping, it remains a serious public health threat. Over 2.5 million teens using e-cigarettes. That's according to the CDC. And there's some funding potential with this JUUL settlement that you may have heard about that could help address this epidemic. Joining us this morning, two ladies on the digital desk here. We have Robin Koval, CEO and president of the Truth Initiative, and Dorian Furman, co-founder Parents Against Vaping e-cigarettes. Ladies, good morning. Robin, let's start with you. How did we get to this point that we have this national youth epidemic when it comes to e-cigarettes?
Well, certainly not by accident, right? This is all about marketing and misinformation. This is a spark that was lit by JUUL, product designed to look cool to kids, very high levels of nicotine, lots of flavors, mango, creme brulee. And, we know from JUUL's own congressional testimony that they marketed these products to kids with social influencers, being on animated shows, all sorts of things like that. And kids were sitting ducks. Right? They didn't know what these products were. They thought they were just fun and flavors. Research we did said that 2/3 of kids didn't know these products always had nicotine in it. And now what's happened is the category is kind of metastasized, right? We have thousands of these products entering the market all the time, kind of playing catch me if you can with regulators. And so where that has left us is we have 2.5 million kids now who are vaping. That's a higher number than the year before, so going in the wrong direction. And perhaps most concerning is that, for instance, 46% of high school kids who vape are doing it 20 more days a month. That means they're really addicted. There's some research that just came out that said many of these kids are vaping within 5 minutes of waking up. That's how addicted they are. And it's kind of two crises colliding now. So we have all these kids vaping. And as the Surgeon General has said, we have a mental health crisis with young people. And what young people often believe is that vaping will help them relieve their stress or their anxiety. That's misinformation the tobacco industry has put out for years, when in fact what the science says is that vaping nicotine can actually amplify feelings of stress and anxiety.
Let me ask you this, Robin. What is this JUUL settlement? How is that going to be helpful to states and communities out there?
Well, it can do a lot. I want to say thank you to all the attorneys general who've been working so hard. Some states have settled already, like North Carolina. There's about 30 states or so that are almost at the settlement stage, about $440 million settlement. And that's a real opportunity to use that money to right the wrongs that JUUL started and continue to affect us, to do a couple of things. Put programs out there that help prevent young people from starting to vape, and also have programs out there to help all these kids who want to quit. 60% of kids who vape want to quit, to help them quit. So as I like to say, it's sort of twofold: denormalize vaping, make it look not so cool, and normalize quitting. Let kids know that you can quit, there's help to quit, you can do it.
Okay, Dorian, over to you. What do parents need to know, and what should they be asking their state to do this morning?
Well, parents need to educate themselves. They need to understand that their kids have been targeted by these companies. JUUL launched the youth vaping epidemic, but, there are dozens and dozens of other products which have taken its place now. So as Robin said, prevention and education is so important. And what the state needs to do really is use this money and target these programs to kids and to parents. Parents need to understand how to support their children. They need to know how to talk to their children about vaping. They need to know how to spot if their child is actually vaping. And, education and prevention is so important. So again, we're so grateful that the states are working to protect their young people. And, hopefully these programs will be put into place, which will prevent kids from starting to vape, but also help those who are already vaping.
Where can people go for more information, parents that are viewing this interview right now, Dorian?
Well, parents can go to our website, which is parentsagainst.vaping.org. We get texts and emails from parents all around the country who are dealing with a child who's vaping and who is having, many of these kids have horrible results from vaping. So they can go to our social media and reach out to us for information.
All right. Well, listen, Robert Koval and Dorian Furman, we appreciate you ladies coming on and talking about this epidemic that's really hitting so many millions of teens affected by this and millions of families as well. Thanks very much.
Thank you.
Thank you.